Welcome to the program Psychologists Speak. So, Buer, I'm sure you must have seen our other earlier panel discussions on various issues after the COVID-19 impact from the senior citizen point of view, online teaching point of view, students' concerns, homemakers' concerns. And today I'm very fortunate to have a new panel with me. In this panel, we have people from various places, and this time we also have a psychiatrist with us. So I will introduce each panelist, then I will start with my question. Let me first introduce Dr. Ritu Wadhawan. She's from Sydney, she's a clinical psychologist. Welcome, Ritu Wadhawan. Then we have another panelist, Dr. Ankur Srivastava. He's a psychiatrist. He's again from Sydney, who will have joined us this time. And then we have the third panelist, Dr. Richa Mehrishi. She's clinical psychologist from Mumbai, working in that area and a freelancer. Then we have fourth panelist with us, that is Dr. Harpreet Bhatia. She's an assistant professor in Delhi University Psychology Department and a counselor. No, dear panelists, I will going to put you a question one by one. These questions which are mostly raised by people because last about so many days we are involved in various kind of counseling of the people. So these questions which I have gathered, and I thought I will take the advantage of the panelists for the point of view of my viewers, so the viewer can be benefited. So try to be to the point, Chris, so that my viewers can take it. I know there are a lot of discussion. We can have longer discussion on the issues which I have, but there are time is limited, so we will try to cover everything in half an hour or so. So my first question will go to Dr. Ritu. She's a clinical psychologist from Sydney. Ritu, could you kindly identify the signs of anxiety that might get in due to the lockdown, and if one or two strategies you can suggest to how to overcome it? Dr. Ritu.
Yeah. First of all, it is very important to understand what is the difference between a worry and an anxiety. A worry is something which I think we all are having at this moment, that I might catch coronavirus, or my near loved ones would catch it, or am I actually following the usual hygiene practices while going to the supermarkets? I think these are the concerns which we all have, and these are normal worries. But feeling anxious or having anxiety is more than this. So when you are preoccupied throughout the day, 24/7 with these worries, or these sort of worries are making you distressed, or if it is causing a dysfunction in your life, for example, the things which you used to do prior to lockdown or prior to COVID situation very well, but you are not able to do it now at this stage. So this is something which gives us a sign that probably you are getting anxious or feeling anxious, and something we need to address to. So that is the time when you need to actually look for some other signs and symptoms of anxiety. And it could be that if you think you're feeling restless, you are always feeling on the edge, that you are not relaxed, that could be one of the sign of anxiety. If you feel that you are being irritable, you are just reacting, where you never used to react previously, that could be another sign of anxiety. If you feel that you're not relaxed, the muscles are pretty much tensed, that could be another sign.
Very good.
Some people have dry mouth. They feel the urge to take on water very frequently.
Okay.
Go for frequent urination. These are the things which could be signs. If you notice some tremors in your hands or shaking of the hands, that could be another sign and symptom. Some people have difficulty in concentrating. So you might have issues with related to work. Maybe you're working from home, but you're not able to do it as efficiently as you used to do it previously. So these could be, some people have some strange feelings in their stomach. We call it butterflies in stomach. Some people have some people have sleep disturbances, be it initiating the sleep or having not a rested sleep. So these are some of the symptoms of anxiety which you can watch for during this period. Now, especially for those people who already have an anxiety disorder, be it OCD, be it PTSD, there is a possibility in this particular situation, they will notice an increase in their symptoms. So if an OCD patient is there, they might notice that they are washing their hands more frequently as they were doing it previously. And it could be because of the anxiety which is going on all around. People watch news. So if if you're watching something related, whatever is happening in US, Italy, or Spain, there is a possibility your PTSD symptoms might come back. I mean, you will notice an increase in flashbacks or increase in difficulty in sleeping. So these are the things which you should watch for. Now, what can we do to avoid these things?
Yes.
First thing is, please, you don't need to be on news 24/7. Restrict your time on news only once or twice. That is it. You don't need it more than that. And also, please read resources which are reliable. Don't actually rely on WhatsApp or Facebook messages. Please take it from reliable sources. That's one thing. Second thing is practice breathing exercises. You can do pranayam, you can do safe place meditation, you can do guided meditation, you can do mindfulness. Whatever I'm telling you, there is ample of resources available on YouTube. So you can pick and choose whichever you want. There are some nice phone applications as well, which you can try. Calm is one of them, CALM, Calm. Smiling Mind is another one. And mindfulness is another one. You can try all of them and you can do relaxation exercises. The other thing for the people who already have an anxiety disorder, what they can do is, and during the lockdown period, they can't see their health professionals. In that case, what they can do is they can actually look for some websites which offer self-help. And one of such website is Get Self-Help. That is one of the very reliable resource they can actually use. And the lastly, but not the least, talk to your friends, talk to your family, use telehealth. Forums like these can surely help you.
Have a network, basically a bigger network of people. Yeah.
Absolutely. And forum like these, like we are having here, will surely help you to cope up with this anxiety.
Thank you, Dr. Ritu, for enlightening us. I know we can have long discussion on these issues.
Yeah.
And now I will move to the Dr. Ankur Srivastava, who is a psychiatrist working in Sydney area. And we will move Ankur from anxiety to depression. Now, I would like to ask you, what are the symptoms of a signs of depression during the lockout time one can have, and then some strategy how to overcome? Dr. Ankur.
Sure. Thank you so much, sir, for the question. I think depression and anxiety go hand in hand often, and many of the symptoms that Ritu has already mentioned are also common with people with depression. Nevertheless, there are certain symptoms which are specific to depression, and the most common symptoms are feeling really low. There is nothing that makes you feel better. There were things that you were able to do before and you were able to draw a lot of pleasure out of it. For example, music, watching television, or doing any other kind of things, eating, cooking. And one of the earlier signs of depression are that you stop interest, or you start losing interest in the things that you loved doing, and nothing lifts up your mood. The other common symptom is a lot of irritability or crying. You become very emotional. Things which did not bother you much before would start bothering you a lot. So you would cry on simple things. Somebody in the family would have said something to you and that would just make you cry, literally burst into tears, which would be very different from your usual behavior. You might have difficulty in concentrating in things that you were able to do and concentrate for long, like reading books or doing your work. I mean, these days, because of the lockdown, people are not allowed to go out and work as they work usually. And so a lot of people are working from home. The working from home environment is not exactly same as how it used to be in an office. So you might be in a compromised position. You might be thinking of 5 different things while you are working. You might be thinking about the family. You might be thinking about the children who are probably crying outside, and a lot of other things. And so you might find that your concentration has gone worse. You're not able to concentrate on things which you were able to concentrate quite easily before. Similarly, a lot of people might have difficulty sleeping. And either they will find it very difficult to sleep at all, or they might sleep but then get up in the middle of the night feeling very anxious and depressed. They might not see any hope in the future because almost 24/7 they are literally sticking to the television, watching what's happening all around the world. And so once you start getting depressed, you are not able to see things more rationally. So you are not able to question these thoughts. You're not able to put any positive thoughts into your worries. And then you just get into this whirlpool of negative thoughts, thinking that there's nothing left in the future. Sometimes a very serious symptom might appear where the person might start feeling that there is nothing left in the life and I would be better off dead. That's a very significant and quite a serious symptom of depression. And I would suggest that if something like this starts happening, or if you start having even death wishes, it's best that you speak with your near and dear ones, or you speak with your doctor, either face-to-face or through online. People who already have history of depression, or who were already going through depression before this pandemic arrived, they are at much higher risk. And they should be careful that at any time, if the symptoms are going literally out of hand, they should seek help as quick as possible. Now, I'll just move on to the second part of the question, how to avoid having depression. So again, a lot of things that Ritu has already mentioned would also apply for depression as they would apply for anxiety. People start feeling depressed when they start losing purpose in life. And that's exactly what is happening at the moment because of the pandemic. A lot of people are losing their jobs. People are losing their usual social network. We are all social animals, and we like to go out, meet friends, watch movies outside in theaters, go out and have golgappas and all those things. And now everything is restricted. You can't do that. So you might have this feeling that you are losing purpose. So a very important thing would be to make a clear routine, make a good routine. It will be a new routine, completely new routine from how you used to work before, but make a routine as if you are going for work. Okay. So have a clear time of when do you want to get up in the morning. You should get up always on time, 6 or 7 o'clock in the morning. Do some physical activity. Any kind of physical activity, mild to moderate, which you can do as per whatever the regulations are at the moment. It could be in your balcony. It could be in your backyard. You don't have to necessarily go out to do that. Any kind of physical activity which is done purposely for exercise actually releases a lot of positive hormones, and that makes you feel less anxious and less depressed. Physical activity. The other thing which is very important to consider is eating mindfully, because these days there is nothing else to do. So a lot of people would eat a lot of junk food rather than healthy food, and that would also have a negative impact on your physical as well as your psychological health. Similarly, catching up with friends in a different way. So exactly like we are catching up here through the tele-networking, use different platforms which have been there for video conferencing. Talk to your friends. Make some plans to catch up with your friends or family, or use this as an opportunity to meet or talk to people who you haven't actually spoken to for years because of your busy schedule. Maybe this is the best time to catch up with them. So catching up with the friends is another good thing to do. And as I said, keep a close eye on any of the symptoms. If the symptoms become too serious, or if it starts causing a lot of dysfunction in your normal behavior, it starts affecting your sleep, appetite, your mood, you get irritable, and it's affecting your relationships, then this is the time to ask for help. Ask for help from a near and dear one, or talk to your nearest doctor, either face-to-face or through telelink, and you may require some help in terms of either psychological treatment or in terms of medication at all.
Thank you, Dr. Ankur, for enlightening us with a lot of points I think will be helpful to our viewers. Now, my next question will go to Dr. Richa. There are many people who are complaining a lot of boredom during this lockout. Okay. Can you suggest some, Dr. Richa, mechanism of intervention, 2-3 intervention by which they can overcome this boredom? Kindly switch on your mic, switch on your mic. Richa, your mic is not working, it's off. Your mic, okay. Oh, go ahead.
Am I audible now?
Yeah, please, yeah.
Yeah, so what generally happens is when we are restricted or prohibited from doing something, we only consider the negative aspects of it. So our focus is only, on what we cannot do. So here my request would be to shift your focus on what we can do and we must do during these times. So what we must do is our daily routine, the mundane tasks, what we can do is we can make them more interesting. So how can we make them more interesting? The first thing is, just because you are homebound, just because you're working from home, please don't be in your pajamas the whole day. I think don't be lazy and complacent as far as your physical appearance, health, hygiene is considered.
No, dress up
And
yourself,
I
dress
think,
up yourself properly, you know.
yeah, I think it is, don't be complacent, don't be lazy, you know, just because I am home, I can be however I want. I think it plays on your mind. It helps you to be active, alert, and happy.
Okay.
So be in proper attire while you are attending your workplace or whatever. Second thing is that you get a chance hereby to design your own day. So please, as discussed and earlier has been conveyed by our panelists, that have a proper routine. Include in exercise, meditation, some yoga. It would keep you calm, patient, have a healthy eating habit, sleep regular pattern should be there. And I think it is very, very important to involve yourself in recreational activities, not only for yourself, but also for your family members. You know, you can do some card games, do board games. You can do so many activities together. There would be no time for feeling bored or uninvolved. And you can also bond with your family members over your household chores. You can always help them together. You can do so many activities. And social distancing is another cause of this boredom, because we are not able to get together, we are not able to party, we are feeling a little bored. But of course, we can take use of the virtual socializing, just as everyone said, and utilize the group facilities. We can chat, we can discuss, we can video conference, we can do so many things. And I remember, Dr. Chadha, once you mentioned that you had suggested a lady who was feeling bored that talk to 10 people and you might feel better, and it worked so well for her. So I think keeping in touch with people really helps us. So, and also it is good time to learn a new skill, maybe a new language, maybe you can learn gardening skills. And if you have some skill, you can teach, you can create a group and teach others. It would be so, so satisfying. I think there would be no time to get bored. There is so much to do.
Thank you, Dr. Richa. Now I will go to my fourth panelist, Dr. Harpreet Bhatia. Dr. Harpreet, it's a lockdown going on, which has been declared by our Prime Minister. 21 day, which is going to be over tomorrow. And tomorrow morning, the Prime Minister is going to speak with the nation at 10 in the morning. And this morning I got many, many calls on this. People are scared if the lockdown will continue, will extend it. They feel it will be difficult to cope with this. Could you suggest some strategies? What precaution the people should take to overcome this, coping with continuing lockdown?
Yes, I can understand that. People are looking forward probably to the lockdown finishing, ending somewhere. And if they get this news that it is going to be extended, it is going to be quite difficult for most people. And I think one aspect which Dr. Ritu has spoken about, I would like to reiterate that yes, we find that it is difficult, that the lockdown may be increased, but we must keep away from all kinds of negative news related to that. The WhatsApp messages which are giving wrong information, those should be filtered out entirely, because the more we listen to it, the more anxiety it causes. And the one basic thing that one can do is change the perspective of the whole thing. Instead of saying I'm locked in and I can't do anything, say that okay, this is giving me time to look into myself and do the things that I wanted to do and never had a time so far to do it. And you may find that you've got in touch with some dream of yours which was long lost, but now since you had the time to think about it, you've got in touch with that again. I can tell you that from my own experience, I had always wanted to work with people who are differently abled but didn't have the time. But now I have connected with a group that is looking after the visually challenged, and I'm working with them. So that is very satisfying for me, something that I had long time wanted but wasn't able to do. The other important aspect is something that already has been mentioned, is keeping yourself occupied in some kind of a routine, and keep that routine as close to what your normally is as possible. Like if you went to the office at 10 o'clock, please continue to work from home from 10 to whatever time that you were planning to do. Of course, you have the big advantage of planning the day as you wish. So, but try and keep it to as close to the earlier routine, because then that will cause less disruption in your life. And what Dr. Richa had mentioned, that if you are sitting at home, don't be lazy about it. I think keeping a clean and uncluttered environment is a very important aspect, because the clean and uncluttered environment outside will reflect the same inside. Just like when it is confusion and anxiety inside, it gets reflected outside.
Okay.
And keeping your thoughts as positive as possible through meditation, through yoga, through guided imagery, through relaxation exercises, any kind of, and some kind of physical activity, as was pointed out by Dr. Ankur also, is an important aspect. And having said all these things, I would like to say in the end one very final important thing, that if you feel anxiety despite all this, that is, you find that you're not able to work the way you usually did. When you're cleaning, your anxiety is in your mind. When you're cooking, your anxiety is in your mind. When you're doing something else, you're feeling anxious, then it may be a good idea to call a professional person and speak to that. There are so many people people who are available online now. It would be a good idea to find out from a professional, speak to a professional.
One should not shy. One should come forward and contact the professional.
Yes, not feel shy about it at all.
Yeah. Sometimes it happens, people feel shy and don't discuss it, And family members also keep a secret, please. They should not discuss. No, my next question will go to Dr. Ankur, and then I will be requiring Dr. Ritu also, because I want the answer coming from a psychiatrist and then for a clinical psychologist. And this is a very, very common question, which is, I think 98% of people are asking this question these days. And in my own relationship and other also, the people who are calling me, the question goes like this: due to this lockdown, restricted movement and activity, which obviously, the person is saying, I have been losing sleep, I started losing my sleep. What step? I will ask Ankur as a psychiatrist, if we can say what step he should take to avoid losing of sleep. Dr. Ankur.
Sure. So sleep is a very common symptom of a lot of different kind of problems, starting from a really bad mattress and a bad bed to really bad weather, going on to a little bit of stress and a sinister sign of quite severe kind of mental problems like depression, anxiety, and many other mental illnesses. And so it is important to know why one is not able to sleep well. So it could be because of anxiety, or it could be because of depression, as we discussed before. It could be simply because of lack of routine. So you might be probably lying on the bed whole day and maybe taking naps whole day. Or even if you're not taking any naps, you are probably not doing any physical activity which will make your brain and body tired, which is important to sleep well at night. Or it could be that because sitting at home, you are eating so much of junk food, fat food, that it causes problems in your tummy. And in the night when you try and sleep, you feel bloated, you can't sleep well. Or you're taking too much of caffeine or Coca-Cola, which might be just taking your sleep away from you because you feel so activated even at night. Or you might be sticking to your phone even at night, looking at how many people have died in the last 24 hours, which one makes you anxious, and number two, which will have increased screen time, and your mind won't night because it has got screen in front of it, which looks like sun, and so you don't sleep. So while talking about the reasons for not sleeping well, I've actually given a hint to what is causing the problems and what we need to do to avoid that. So very simple answers are: have a routine, do not take naps during the day, and do some physical activity and make a routine for yourself. And of course, Ritu can also add from her.
Yes, Dr. Ritu, clinical psychology, your turn,
Yeah, adding on to what I think, whatever pretty much summarized by Dr. Srivastava, but I could quickly add on certain points. Yes, being in the lockdown, more of chais, more of coffees, more of cold drinks are happening probably. So try and not to have any of the caffeinated drinks after 6 p.m. Please don't have that, and stick to not more than 2 in a day. Have a pretty much fixed routine, fixed time to get up, fixed time to sleep, avoid any daytime naps, include 30 minutes of physical exercise in your day-to-day routine. Plus, very important is please don't use any of the devices in just an hour before you go to sleep. So you can use that time to read a book. You can just use the time to read a book, or pretty much to listen to a good soothing music that can help you in sleep. Research evidence is mixed, but you can actually try having lukewarm milk just before going to the bed, because that at times assists in sleep. Follow a strict bedtime routine. Please don't use bed for anything else except sleeping. It shouldn't be that you are eating there because you are at home. It shouldn't be that you are eating on bed, you are watching your phone on bed, or you are working actually from your bed. Yeah. Please don't do that. Use bed only for sleeping, and have some bedtime routine. Brush before going to bed, or having milk. I think these things will help you to have a good sleep.
Thank you. Now, my last question will go to Dr. Richa, and then maybe after that, Dr. Harpreet will also partly answer that question. The viewer is saying that I'm just at home doing nothing. I'm not contributing anything in that case. And I'm getting a thought of worthlessness in me. How I can overcome this kind of thinking I'm worthless? Dr. Richa.
Yes, sir. So we all are in this novel situation whereby, under lockdown, social distancing. So it is quite normal to be anxious, tensed, and feeling a little hopeless. But first and foremost, we should understand the facts of the situation. That this situation is temporary. You're not the only one in it. We all are there. You are in your home, safe among your family members, and that is quite a blessing. And then you have work to do. Even if it is a work from home situation, you still have work to do. So be happy about it, be kind. Of course, you can plan your work, plan your day, allocate specific hours for working, take breaks, regular breaks. And as always suggested by all the panelists, in all other discussions always, that it is very, very important that you maintain a routine, whether it is your daily routine, your exercise, your sleep pattern, anything. And there is so much to do. Again, there is a big importance of your positive thinking here. There is not that there is nothing to do at home. Please, there is so much. Please help your wife or other family members in household chores, involve your family. And if you already haven't been doing it, write a diary. This is a very important thing, very impressive channel to vent out your emotions. And it might help, maybe, tomorrow it might be a crisis memoir for all you know.
Dr. Harpreet.
So,
maybe. Dr. Harpreet,
okay.
I would just like to add one very important aspect, that you need to be very kind to yourself. Don't keep putting yourself down, because even the small things, you tell yourself that you have done, and also call up at least one individual for whom you feel it would be a huge thing to get a call from somebody. And make that person happy. When you make another person happy, you feel happy yourself. That is an important aspect.
Thank you. Running shorter time. Ritu, you want to add one point?
Yes. I think, sir, it's the time to redefine your goals. That's what I want to know.
No, I will go to last, I will ask each panelist, because time is running short, I just want each one of you to give 1 or 2 points how one can maintain with the good mental health during the lockdown time. I will start with Ankur. Ankur, 1 or 2 points.
Yeah, sure. So maintaining a good routine and keeping a close eye on any symptoms which are making you dysfunctional, and seek help for it.
Thank you. Dr. Richa.
Yes, sir. Again, firstly, have trust on the medical practitioners. They're doing their best. Please stay positive, stay calm. That is very, very important. And don't waste a crisis. Please have a routine.
Thank you.
Do something good. Be kind to yourself. Be kind to others. And, and as everyone has already mentioned, if you feel that your anxieties need to be addressed, please don't shy away from taking help.
Dr. Ritu, just short, 1 or 2, 3 points.
Yeah, I think it is important to plan ahead. Go for one long time routine during this period of lockdown and think what one skill you would like to upgrade. It could be cooking, it could be baking, it could be anything, and have some short-term goals which you fulfill every day. Do some activity that energize you, do some activity that calm you. That's it from my side.
Dr. Harpreet.
I would only like to say that shift your focus from self to the others. The moment you shift the focus to the others, you will find a lot of relief and ways of doing
Relief and joy. You will find a lot of joy in that.
Lot of joy. Right.
Thank you, panelists. You have given a lot of points, a lot of things you have given. I'm more than sure that I enjoyed this panel discussion, I'm sure you must have enjoyed it. But most important is that my viewer will enjoy it. And I'm so sure they will enjoy this, definitely. I know there are a lot of things to be discussed, a lot of points can be discussed, but due to time limitation, I will close down this panel discussion today on this, at this point. But maybe in future, maybe 2 days, 5 days, whenever you have time, I may request you panelists again to come forward and because I've shortlisted a few questions which I put, but there are a couple of other questions also, and those questions also I will take. I will also request the panelists and viewer also, if you have some kind of question you have in your mind, kindly send the question to me, so the next panel I will try to take that questions. So I know it's a late evening. It's somewhere about, I think 10 p.m. for Ankur and Ritu there in Sydney. And have a nice good night. And to my colleagues here from India, Dr. Peter, Dr. Richa, kindly have a nice evening and stay safe. I'm sure that we will overcome and keep ourselves mentally and physically fit, even after the crisis which we have, unexpected crisis, the enemy, invisible enemy in front of us, which we can't see. I'm sure we will come out from this. Thank you. Bye.
Thank you.
Thanks for the opportunity.
Thank you so much, sir. Thanks.